of the night, we have, if somebody is in one village, in the middle of the night, if anything happens and the person is waiting, till the following day to go to the secondary facility, that would have been late. And health should be, we are always time conscious when it comes to health. So when you get to the primary center, there is an experienced hand there to handle, and good enough in all those primary centers they're in local governments, and we have doctors in those local governments, and I can tell you that they call doctors if there are emergencies. They call doctors, and doctors will come around and attend to such issues before being referred.
Dr. Adetunji, it's good.
Thank you, sir.
You're spotlighting all of these issues that the primary health care should be the go-to place, and rightly so, because that's the closest to the people in the real sense of it. But those are for places where they are viable. There are also some places in Nigeria where it's also a shadow of itself. You find investigative report to say, look, this primary health care system or center has been, awarded, Senate contracts have been awarded for the upgrade of uplift of this primary health care, and they are not in existence. So that leaves the people also at the mercy of trying to find health service, perhaps somewhere far away. But really, what's the situation across Nigeria, or the situation of our health or our health sector in Nigeria? It's multifaceted, but really, what's the current state?
All right, thank you, sir. Well, you said all over Nigeria, because when you are talking, I was thinking, I thank God for Ondo State. The government is doing very well. That's the truth. I've been to some villages, and I saw health centers, and I saw personnel, and I was surprised. So, but when you said all over Nigeria, yes, I will not disagree with you. All over Nigeria, but the truth is, even as at now, there are so many. These issues did not start today, and there are so many strategies that have been put on ground, and there are a lot of work still ongoing. There is over the years, of course, they evaluate some of these programs, and with the evaluation, they try to improve on the system. So many programs have come on, have been on board now. We have the primary health care under one roof, just trying to strengthen the system, the management in place at the local government. And there is something now that is ongoing. We have the BSc, that's the Basic Health Care Provision Fund. Yes, and I think Ondo State government is really utilizing that, because we're one of the places where I also supervise is operational. So, and that is actually ongoing. And you know that we have resources are always limited. The government will work based on the resources they have. But one good thing, as long as the government is still moving, then we're sure that we'll get there. And as long as we have good leadership, what we need is actually political will. Because it's something to have, it's one thing to have one thing on paper, it's another thing to about good enough we know those things. I think the government is doing well. So if we can have good the political will all over Nigeria, I think we will get it, because there are a lot of good strategies in place that will help us out.
When you talk about political will, does that also mean that the amount of resources allocated to the health sector in terms of the budgets, planning?
You are very right, sir. When we talk about resources, it's not just money. People talk of money. No, human resources, in fact, that's the most important. Because once you have a doctor in place somewhere, that changes a lot of things. So, we talk of the human resources, we talk of, yes, the budgeting, putting money in place. You understand? We talk of materials, because if the doctor, no matter how experienced the nurse is, if you have a labor case and there is nothing to deliver that little child, I'm telling you, the nurse will just be looking, and that patient may bleed to death. Yes.
So sorry, you still don't want to blame the people then for not going to the community health centers. There are no doctors there.
No.
That opinion. You see that the opinion is valid.
It's not actually in the real sense. Well, logically, you may say that it's valid, but in the real sense, sincerely, it's not valid. Because I've told you about the referral system. I've told you that you can call a doctor on call. If there are issues, I've been called several times in a center. Yes, I will go there to attend to. The way this we don't have enough resources. You must know how to manage the resources you have. How many doctors do we have?
But apart from on saying how many doctors do we have. There is a huge gap between the numbers of doctors that are in urban centers and those that are in rural areas. Because in the urban centers, we have more than enough in some places, while there are none in certain areas.
If I am the answer you on that,
yes.
If I tell you that, that is just an assumption. Because even in the cities, in the urban settings, doctors are not even enough. You may not believe me, but please go and do your statistics.
Doctors may not be enough, but they are more in the urban centers than in the rural areas.
But you can't blame the doctors. You can't. And even at that, in government now, structures are on ground. Me, I can talk of Ondo State. I can't talk of structures are on ground. And that's what I told you about. A doctor has the capacity to cover the local government. And that's why we have PAC coordinator. Because that doctor has the capacity of the nurses in those primary centers have been built. And they know when to refer, and they know when to call doctors for emergency cases. And do you know the truth? Most of the issues that we have is not even, because most of the cases that we see, if they come to the hospital, to the primary centers early, the issues will be nipped in the bud. And that's why I talk of the responsibility of the citizens.
All right. Yes. One of the key missions of WHO is to prevent, elevate, and stop altogether the spread of deadly infections. Yes. At the time, Nigeria was talking about celebrating the eradication of polio and some other infections. How many of these have we been able to stamp out of Nigeria in collaboration with WHO?
Yeah, I'm happy to hear that, because Nigeria, we are the giants of Africa, and good enough is not just by name. In healthcare, we're in achievement of some things. Like, it's not only polio. There are different types, but the wide polio virus I will talk about mainly, was actually we were certified. That was on the 25th of August 2020, and I think that was a very big achievement for Nigeria. And not only that, you must have heard about guinea worm. That you used to see some pictures those days that they would pull out worm from somebody's leg. It was also eradicated too. We were certified in January 2014. So I think we have been doing well in that achievement, but we have not. That's why I talked of WHO, because it has been with the support of WHO, because that's one of their functions too, and they've been doing well in that, and we have been cooperating well, and that's the essence of public health, and that led to the achievements.
I'm looking at statistics right now, a breakdown of health conditions in Nigeria, and perhaps if anyone should get that, it could also be right in a way to say Nigerians are perhaps one of the sickest people in the world. Why is that so? Do we really need to, if we do things right, do we really need to have a visit to health centers as often as we do right now?
Let me go back to primary health care. See, everything we talk about health revolves primary health care. It has pillars, and those pillars, the most important pillar, it has community participation, and intersectoral collaboration and all that. But the most important pillar is the political will. Once we have good political will, things will fall in place. I told you earlier that, I will not agree with you that we are the sickest anyway.
Perhaps one of the sickest.
Anyway, I need to see statistics, because
for instance, we are number 5.
When you check the issue of malaria, you are there. When you check the issue of HIV/AIDS, you are there. When you check the issue of mental health, you find Nigeria also, in the mix of those topping the list. When you check so many other conditions, you find, air pollution, the effect on, citizens and all of that. You find Nigerians also in the mix in terms of how they place on the statistics table. What does this tell you as a health practitioner?
The truth is, one thing you should look about in Nigeria is our population. Population is one big issue that if it's not well managed. Now, let me give you an example. It's easier for a man that has a family size of 5, the husband, the wife, and 3 children, to be able to manage the family than a demand that turns up to like 12. Nigeria, the population is big, and when you have big size, you also have big problems. And that is why big size will need strong leadership, will and commitment across all states, across every sector to make things work. Yeah, so because that population is actually causing issues for the resources that we have. Okay. So that's why we're having some of these issues.
Alright, talking about population, I know that WHO too has been trying when it comes to the use of contraceptives as family planning issues and all that. How well has Nigerians been able to embrace, family planning? Are you making headway?
We are making headway, but sincerely, I would like to tell you that it's slow. It's slow. That's the truth. I think the contraception prevalence rate, I think, should be around 60% thereabouts, and that's not too good. That's not too good. We still have people that you'll be trying to convince them. Someone said that so many people have a lot of misconceptions about.
There are cultural biases.
Cultural biases, yes. Then people tend to listen to their peers. Women in market, they listen to their peers, and it's unfortunate, even some educated fellows too. They still believe that there are some things that family planning will do some harm. No, family planning is to help us to control the population. How? It's not that we're not going to give birth. It's even going to safeguard the health of the mother because of child spacing. To have the family size that we determine, to have the pregnancy when we determine to have it. You understand? So that's one of the issues that we have. Well, I know in the southwest, I think we are doing well, though except for some areas, but there's some other regions of the country that is contributing to hit these issues. For some of the issues that we have, I'm telling you this, some of them they stem out of this population issue. Even the issue of insecurity. When you don't have enough resources and you have a lot of people to handle those resources, then the resources will not be enough. Of course, people will look for other means to fend for themselves, and they turn to crimes. So that's the population is a very big issue that I think we really need to look into that.
All right, tackling mental health issues now, because enjoying good health does not necessarily mean living without diseases.
Yeah.
It means achieving a state of complete physical, mental, and social well-being. So mental health issues in Nigeria, the awareness, is it enough? Are people seeking help, for mental health? Here there is a huge stigmatization where you say, they immediately think of one guy in the market square, roaming naked and all that. So our attitude towards assessing mental care, is it enough?
Thank you. It's not actually enough. I really appreciate you for this program, because it's also an opportunity to create awareness. When we say mental health, it's not about being mad, because unfortunately that's what people think of. People run mental. No, it's not about that. So many people that have mental health issues, and you know one thing, once there is mental health issues, it affects productivity across board. So many people are depressed. In fact, some people, even mere listening to news, they get depressed. And it affects the house foods anywhere they go. I see people every day having mental health issues. Not that they are mad, but it's affecting their output. It affects so many things. So mental health issue, when we realize that something, in fact, the one way that I look at it, when somebody tells me something, and another person is saying the same thing, that I tend to sit back and think about it. Not that this is where I am. We can always have good mental health. Yes, we know that so many things are happening around us, especially in this period, that could make you to derail mentally. But people should please try as much as possible to have good mental state. Have a peace of mind. Engage in things that make you to have peace of mind. That helps you. And if anything is disturbing your peace of mind, me advice, just move away from that thing. It's better. Because somebody said there is a thin line between being mentally stable and be mentally unstable, and that's the truth.
Okay,
It
but
starts gradually.
how will one know that I need to check myself now? How would you be able to tell or to say, oh, this my child or my husband or my wife, needs a mental practitioner?
Yeah, I'm going to speak as if I'm talking just in lay language so that people will
Yes.
understand. Good. It's always good to have a reflective mind from time to time. After, the wise people, do you know that at times they take break and they leave the environment. They go to a seaside just to get their mental state back. And it starts from you taking your leave. And if I ask people, when they take their leave, what do they use it to do? To go from one business? We are always running after money. All those stress, they are not keeping us mentally well. Have reflective period. We all started from a place. How are we now compared to where we were coming from? You understand? We will notice some things that have changed. Some things must have changed maybe in our mind, because mental is a state of mind. So then what can I do? So it has to be personal efforts. At times, if something is disturbing so much, we don't have that, attitude. We have counselors, we have psychologists that we can approach, and they will counsel us. If our counsel can help. Someone said a problem shared is half solved, but it depends on the person you are sharing the problem with. But that person can also multiply it. So the place of counseling is key. In fact, it's one of the key things in rehabilitation. So once you realize that mentally there is something wrong, or somebody is telling you, maybe my wife is telling me, there is no issue, then I must know that. For my heart to be telling me that there is something wrong, because he is somebody that lives with me every day. So when people are saying something, we should think about it, not just assume, because one major issue in mental health derangement is the person may not realize. Yes, ma'am.
So it takes people around to say.
When people are saying it, then it takes a reflective mind. Now, if I sit down, okay, how have I been faring? Over the years, I used to be happy. So what is making me to be unhappy now? So we need to have a reflective mind, relax, then we'll be able to pinpoint the issue. So if I need to visit a counselor, yes.
Okay. 2020.
Yeah.
The issue of COVID-19, the world experienced a shocking moment and all that. Then, thank God, everything is almost getting back to normal. At least our social life is almost getting back to normal, though the economy is yet to recover from that experience. But yet, somehow along the line, last year we still had instances of the National Center for Disease Control saying that there are still instances of COVID-19 in the country. What's the situation now?
I can tell you that based on the last guideline released by the NCDC, is under control and is well contained now. And kudos to the NCDC. The vaccine, now we have vaccine, different types, and the vaccine is helping. There is something we call herd immunity. Immunity is the ability of the body to produce antibody. Antibody is something that fights against infection that is coming. So herd immunity, when majority of the people, when they have the immunity, then it forms a strong coalition that even people that are prone, that are susceptible to that infection, they will still be protected. So the vaccine is really helping out. That's one. That's one of the reasons why it's under control. Then again, over 80% of COVID-19 infection is actually mild, and things have also yes.
Now or then?
Even then, thank God. If you in Nigeria, we should just thank God. Can you compare what happened here to what happened in Brazil? That they don't even have a place to bury their dead. You understand? So then many of my colleagues were actually infected, but people will not know. But from their symptoms, that this person has COVID, because of course then because of stigmatization, some people were afraid to go for testing. But people, they recovered. They took, necessary drugs and they recovered. So most of those people that also recover, in a way, they would have had a level of antibody. That also helps to maintain the herd immunity. I think that is one of the things that is helping. And I still want to encourage, the vaccine is available, please, because you are not just taking vaccine for yourself. That's the truth. We call it prospective. We are not taking vaccine for yourself. You are taking because of the community. And that's still part
Dr. Adetunji, while we talk about universal health coverage,
Yes, sir.
the place of women and children is also key in the conversation in the health sector. And that brings me to the issue of the maternal mortality rate in the country. The Minister of Health, Osage Ehanire, says lack of access is part of what is contributing to this figure that we have. About 576 maternal mortality per 100,000 yes, so live births. And when you take a look at that, it still points to the fact that we're still getting some things wrong.
It's actually, it's saddening, because if you see a woman, of course, pregnancy is a thing of joy. And when you see a woman that is supposed to deliver and be enjoying with the family, with the new joy, and the woman is not there. So, in fact, if you've been in a hospital and you've seen some maternal mortality cases, you will not be happy. But we shouldn't blame government for everything. I know government has our own issues, but we shouldn't blame government for everything. There are issues with the citizens, and that's why we are creating awareness. There is something we call delays. We have 3-4 delays. The first delay is this woman, when she's pregnant, we try as much as possible during the antenatal training to prepare them for bad preparedness on how will you deliver, where do you want to deliver, in case you may want to travel to go and see your in-law or whatever. So we help you to plan how you will have adequate and proper delivery to be attended to by skilled birth attendant. That is very important. But unfortunately, in our setting, men are the decision makers. The husband may not be around when this woman falls into labor. And usually, I don't know, the way God will have it, most labors happen at the middle of the night. You understand? Due to some scientific reasoning for it. So now, when it happens and the man is not around, and the neighbor, you're afraid that I don't want my neighbor to carry me because of one wish or wizard. We have so many cultural issues, and this woman stay, and this may be a woman that is at risk. The woman stayed till the following morning. By the time she was able to get somebody, it was already too late. Gets to the hospital, the closest place is the primary sister. We can't afford this, we need to refer. You write referral, no ambulance. We are fighting. Eventually, they were able to get by the time the woman gets to the maybe secondary facility or the nearest. At times we'll just be able to save the baby. And the woman, I've seen that over and over, and it's so sad.
So the citizens have a role to play in this.
Sincerely. In fact, when I was told of this program, that is one of my major goals. That we citizens should take responsibility of our health. Let's get there.
We'll come to that in terms of how aware citizens should be about their health. Going forward, we'll get to that conversation.
Okay,
but doctor, about 13,000 between 2021 and 2022 of your colleagues left Nigeria for the UK. Why are you still here?
Why am I still here? I think you should give me kudos for that. Yeah, you know the answer. But I'm going to explain. The reason we studied for 6 years, ideally, like many of health practitioners. I'm telling you, with no failure, so many would have studied for me for like 8 years. I spent 9 years in school, not because I failed, but we all know the reasons. We know what happened last year. How long people stayed at home? No, a lot of issues.
Over 8 months.
Thank you. So you are in medical school, unfortunately. Medical training is not something you can just do and stop at. No, you have to. So many things, you have to come back to it again. So that's why those years must be completed. And of course, if you know, few years ago in UK, medical doctor, they collect us about £4,000 in a month. You can do the conversion. And that was then. Do the conversion. I won't tell you how much we collected. So, even if you are a doctor, sir, your wife will push you to leave this country, even if you don't want to leave. Some of us that are still around is due to so many reasons, because I don't know. When I was in school, I just like Nigeria. That's why I'm still around.
How do you think Nigeria can reward people like you who have decided to, stick with the sheep, even though it's facing some challenges at this time? Because we're talking about universal health coverage.
Yeah.
We are talking about health for all, and we have a target of 2030.
Yeah.
and we have personnel who are supposed to also help drive this process leaving. That's the issue of the gap and the brain drain in the health sector. So putting all of this together, how must we begin to tackle? Just coming on this program, at the House of Representatives, they are debating about not even allowing doctors to do that. But really, beyond those measures, how do we change this narrative to ensure that we meet this target, we improve the system?
I'm going to pick one of the pillars of primary health care, and I'm going to really appeal to every the level of government, whether executive, or the House of Assemblies, even at the National Assembly. There should be intersectoral collaboration on this, deliberation. It's not about just promoting a bill. You understand? You need to engage the stakeholders. This is not a skyrocketing. It can be achieved. We have to sit down around the table. We have NMA, we have our bodies. You understand? They should sit down with our elders, with our bodies, and let them deliberate what is the way out. I'm very sure that NMA must, they already have the templates. So the government should listen. Of course, when there are issues like this, there's always a meeting point. Why can't we just sit down and get to a meeting point on this matter so that everybody will agree and that people will not harm you? I've seen people, a lot of my colleagues, that never thought of traveling. In fact, last year, one of them called me and said, that it's like I don't know what's wrong. Something is coming to my mind to move. The guy has moved now. He's in UK.
That leaves you with those who are here with pressures.
Thank you, you understand. So that's also government should please quickly call our bodies together. Let's talk, let's have a dialogue, and let's reach a meeting point.
All right.
This should not continue.
While we try to wind off on this this conversation, the issue of Nigerians also take a responsibility for their health. Many have said what Nigerians eat, is what is putting us in this situation. Many don't even really care. You find, vendors outside, So really, what will Nigerians start doing to get it right? At least the first level of prevention. If they're going to have malaria, it should be okay, heart of the blues or something like that. What must we start doing in all of this regard?
Thank you so much for that. And I want to encourage every citizen listening to us. Please, you have the right to a good health, and it starts with you. And the first thing is, if you don't approach the health facility, how would you know what the issue is? Those primary health centers, please, I'm saying it again, it's not just for mothers or for children, it's for everybody, including the elderly. So let's approach those primary health centers. Let's go and have a medical checkup. They won't push us out. You just have your card, go there, have your medical checkup, check your BP. If you have any complaints, then I have to say this, you don't need to have a medical complaint before you go to hospital. Over there outside the country, people go for medical checkup from routinely, and that should be their deal base. Especially growing older. In fact, these days I won't even say lost growing older, because I've seen less than 20 years having high blood pressure. That day I was shocked. Yes. Less than 20 years.
For that?
No, there are so many issues.
Okay, maybe it talks for another day.
Maybe. Well, there is something we call modifiable lifestyle. Lifestyle too is very, very key to that. So let's go to those primary centers. We should not neglect them, because some people get discouraged when they go to tertiary institutions or saying the queue, and all the protocols, so they get discouraged. But primary centers, you get there, right there, then you go to the record, you meet who are supposed to, within a few minutes, you are done. So let's take responsibility. And the first responsibility is, one, go to the hospital for checkup. If you are having any issue, please don't assume. Don't be taking about concussion, agbo, akibo. Oh, no! Go there to the primary center. Let them diagnose. This is what the issue is.
All right.
Thank you so much.
Thank you very much, Doctor, for coming today on the show and for sharing your thoughts with us on the topic that we've discussed today, that I was talking about health for all, how achievable. Yes, and in achieving health for all, you've insisted that individuals have a role to play. Thank you very much, Dr. SUBULADE Adetunji for coming on the show. We believe next time we have more to discuss, and we'll call on you.
No problem.
All right, my dear viewer, this is where we'll be drawing the curtain on today's show. I believe that you've learned one thing or the other from the show today, if nothing at least that you should take responsibility for your health. And from Zaid?
Of course, just like Dr. Adetunji SUBULADE said, you have a responsibility, you have a right to good health, and that starts with you. But for health practitioners also, just like you has mentioned, the pressure is real, but really the responsibility to the people who will also run to you for help should remain paramount. I'm Sahid Aribisala. Enjoy your Good Friday. We'll be back on Monday.
All right, my name is Folashade Ogidon.